My name is Dr. John Lucich. I'm an associate professor of health sciences in the College of Pharmacy and Health Sciences. I started at Butler in the mid-90s when the physician assistant program was first starting. Prior to that, I was working as a emergency medicine physician. Currently, I teach anatomy, physiology, evidence-based medicine, and clinical integration. I use technology in virtually all of my courses, but the most important use of technology comes probably in the anatomy course, and that's what we're going to be demonstrating today. The anatomy, as you might imagine, is not something that you can teach. It's something that more or less needs to be experienced. And one of the things that I really like to do in the anatomy class is use a program called ADAM. The nice thing about it is it allows students to do a virtual dissection in 2 dimensions to get a feel for 3-dimensional structure. So you can start at the skin, remove blood vessels, and just keep tracking down the body until you get all the way down to the bone. And you can do that in a variety of different orientations. The primary issue was finding, again, the ADAM program is wonderful, and it provides an opportunity to do dissections over and over and over again at essentially no cost. You know, once you pay for the program, you can do the dissection over and over. You can't do that very well with cadavers. You can't do it very well obviously in a live patient environment. So this allows students to practice the techniques to be able to anticipate what the next structure down is going to be, what the next structure down from that is going to be, much like a surgeon would when they're doing a surgical procedure. So using the program ADAM to begin with is, I think, a good first step. We show the basic ADAM program, and we're actually doing a leg dissection at this point. So at this stage of the game, we've dissected down 195 levels into the anterior thigh and showing the structures that are present at that level. Then this next shot here basically shows that when the student places the cursor over a particular structure, ADAM will actually highlight the name of that structure. And that's as far as we go. What it doesn't do, as we mentioned before, is it doesn't show the function of the structure, its innervation, its blood supply, and its connections, really. Where does the muscle come from? Where does the muscle go to it? So all of that very important stuff is lacking in this particular view, and that's where the iPad comes in. Now what we're seeing here is the iPad 2 using Keynote, the iPad program for PowerPoint. And this is basically what I've developed. We're starting here with the anterior thigh, again level 195, just like we showed on ADAM. But the next slide is basically a screenshot of what we saw in the ADAM program. We're highlighting the same muscle, the vastus intermedius muscle, and that gets us to the same place that we were in ADAM. However, you keep clicking, the very next slide shows the very truncated, very focused, very practical information that I was saying was lacking in the ADAM program. Adding the additional information and making it readily and conveniently available so that the surgeon can think, this structure does this. If I cut this, what are the consequences of that action going to be? My addition in the PowerPoint presentation allows the students to quickly get that information. And honestly, particularly with the use of the iPad, that information can actually be theoretically used in real time, actually in clinical circumstances, to kind of follow the path of a surgery or follow the repair of a traumatic injury. I'd never touched an iPad before a few weeks ago, and now I would consider myself fairly proficient at it just by talking to people who know what they're doing and asking specific questions. I think a mistake that we tend to make is we think that we have to be masters of the entire hardware and software before we start to use it, and you don't. You say, you have to ask yourself, what is it that I want to do? Find somebody who can teach you how to do that specific thing, and just do it. It's relatively easy to do for lots of different sorts of applications. You just need to know what you want and who to ask, and certainly resources are available here at Butler.